Welcome back to the morning show. We continue to prepare for the Illinois Marathon. But if you've gotten sidelined due to an injury, well, we are here to help you today to make sure you can get back to that race. Rick Jean is here with Christie Clinic's Physical Therapy and Sports Medicine Department to talk about what we actually need to do. And we'll kind of go through a few scenarios here and kind of just give us what it is and how to treat it. Let's start with shin splints. This one seemed very, I guess I knew this one, so I figured we'd start there.
Yeah, shin splints are a common problem that long-distance runners come up with, usually halfway or towards the end of their training period. And shin splints are just a generic term for pain in the shin area, in the tibia-fibular region. And two main causes would be a muscle imbalance that we can get in the front portion of the leg, where our calf muscle is actually stronger than the front portion of our leg. And so as we're running, if we have some foot strike problems or some heel strike problems, you'll start to get some irritation through that. The other one would be in the opposite side, or the medial aspect of the tibia, where we start to have pain, and that's a lot of times associated with a fallen arch or a biomechanical problem because your shoes are not fitting properly.
Yeah, we've talked about shoes before, and we know how important it is to get that correct fit.
It's very important for shoe wear, especially for training for the marathon, not only for training but also participating in it. But when the shoes start to break down or the arch support starts to give out on you, then we start to get some problems in the shin area itself, and so that shin splint pain comes up. And a lot of times you have to cut back your training a little bit, start working on some different things, whether it be icing, stretching, check on your shoes, and maybe even start training at a different pace or on a different surface itself, because surfaces themselves can cause a lot of additional shin pain. I know for a fact that a lot of my patients that train indoors have a lot more shin pain than if you train outdoors. So you might start looking at that.
Yeah, I used to do a lot of outdoor training whenever I ran cross country back in high school, and I was always outdoors. And as an adult, I've been doing more training on treadmills, and I noticed that shin pain coming up much more quickly. Yeah. And it's just because of the hard surface.
The surface that you run on, especially indoors, can be a lot less forgiving than it is outdoors. Surprisingly, like running on sidewalks or even on streets are a lot more forgiving than running indoors. So once we make that change, a lot of times that'll make a difference. Another reason shin splint pain will come up is when people in their training regimen make too drastic of a change in their intensity. They're running at 5-6 miles a day, and all of a sudden they'll jump up to 10 to 12 miles a day. That's when you start having a lot of shin pain.
All right, well, let's move on to heel pain now. What are some of the causes of heel pain?
Well, there's two main causes. Let's address, like, if you're a younger runner, that sub-18-year-old runner, we still have some soft areas in our bones that we're growing with, the soft tissue, and that can become kind of irritated, and it's actually what we call Sever's disease. It's an irritation of the soft tissue of the heel, and that can be quite debilitating. So that might mean that the child or the athlete's training a little bit too hard if we're talking about the marathon. The other would be just heel pain itself. There's actually a fat pad in the back of the heel, and shoe wear, again, is a big problem. And I actually brought a little device that we sometimes give out. It's called a heel cup. It's just a spongy heel cup that you can use that'll give you a little bit of a cushion in the back portion of your heel, and that will take a lot of the pressure off. Unfortunately, with the heel pain, stretching and icing are not something that really addresses it. It's more of a concussive type problem, so the heel cups at work, changing shoes, getting a shoe that's a little bit more cushiony in the back end will help some too.
Well, that's good. So it's something that we can easily repair prior to the race. And get ready for that.
Right.
Very good. Well, how about Achilles tendinitis?
Well, Achilles tendinitis is an irritation, obviously, in the Achilles, and the Achilles is the big tendon that runs down the back of the heel, and we can get Achilles tendinitis from a myriad of different problems. Overtraining, mechanical problems where the shoe will actually rub up on top of the Achilles itself. It'll give a problem. Or it could be the fact that your surface running, again, is causing difficulty. When we run, we have two major muscles that we use to propel ourselves, the quads and the calf. And because of that, they get overworked, and if we get too tight in that region, that Achilles will start to take a lot more stress. One of the main symptoms of that, outside of pain, especially pain in the morning that you might have when you get out of bed, is some swelling in the back of the Achilles itself. You can actually feel a little bulbous area in that region. It's tender to the touch. one of the things that we really need to make sure that people understand when we talk about Achilles tendonitis is that swelling is compromising the strength of the Achilles, and so a tear or a rupture of the Achilles tendon is quite common when you do have Achilles tendonitis.
So you really got to be careful not to run on that. And
right, and you need to make sure you're careful. You need to make sure you probably consult with your physician or a physical therapist or somebody about that, because it can lead to obviously longer term problems for that. Stretching and icing are very important for that kind of a problem. And another thing that you can use, and I brought something else, just by putting a small heel lift in the base of your running shoe will take a little bit of an extra stress off of that Achilles tendon, give it a little bit of rest actually while you're running, so it's not quite so sore. But that is one problem that I see that people have that can be very detrimental to the running and needs to be addressed before they continue.
All right, that's good to know, though. So if you've got that pain, definitely see a physician first before you continue the training process.
Correct.
All right, now on to knee pain. I know a lot of times some people associate it with getting older, but I mean, what are some of the common knee pains that you see with runners?
It can be because you're getting older. Sometimes arthritis will cause some of your knee pain. You can get some patellar tendonitis in the front portion of the knee, kind of the same scenario that we get with the Achilles tendonitis. It can be associated with the changes in the surface that you're running on. It might be that you're a little overweight when you're running, but that patellar tendonitis can have the same problematic things that we have with the Achilles. Swelling, painful to the region, hard to run on. Ice and stretching will help, but again, that should probably be addressed somewhat by a healthcare practitioner because of some of the other things that it might be associated with. Another problem with knee pain would be some outside knee pain or lateral knee pain. And with that, it's what we call iliotibial band syndrome, and that's a killer for long-distance runners.
Really?
And that's something that's not easily diagnosed. It has a lot to do with some hip problems or some hamstring problems, some tightness with that. Ice and some stretching will work on that, but that's something that really needs to be addressed by someone in the healthcare profession.
And so it's generally on this outer portion
generally
of the
on
knee.
the lateral aspect of the knee itself. People say my knee is hurting when I run, and it might not bother you the first mile, mile and a half, but all of a sudden it'll kick in about the 5-mile mark, and it's just to where they can't run, and then it becomes worse and worse and worse, so they just can't run at all. So people that are in the middle of their marathon training now, that's when it really starts to kick in. So don't delay. If you're having problems, make sure you see somebody about it for sure.
All right, and how about the last thing, plantar fasciitis? What is that?
Plantar fasciitis. Plantar fasciitis is, I brought a foot in today, a little model. Plantar fasciitis is on the bottom aspect of the foot, at the base of the toes to the base of the heel. There's a broad ligament shaped almost like a triangle that supports the actual arch of the foot itself. And when that becomes irritated through excessive running or such, it's very painful. One of the main symptoms is first thing in the morning when you get out of bed and you take a step, it feels like somebody's stabbing you in the heel with that hot poker. And it can affect your training, it can affect your lifestyle. I find a problem with women more than men because women have a tendency to wear heels to work.
No, we never wear heels.
And that shortens up your plantar fascia a little bit so that when you go to train, it's under a little bit more undue stress. So in that aspect, a shoe with a good arch support is very important, or a shoe that does not pronate is very important also.
Well, thank you, Rick, so much for coming in this morning. Again, with Christie Clinic's Department of Physical Therapy and Sports Medicine, some great advice here. I think the main thing out of all these symptoms is that, it is good to consult a physician on any of this.
Yep, especially nowadays.
All right, Rick, Jean, thank you so much for joining us.